Hi again. This is the last lecture for this unit on muscles where we're going to be also talking about the TMJ. So, first slide is a suggestion. Read the objectives for muscles and the objectives for the TMJ. And I'll mention it now and I'll mention it at the end that I want you to practice writing an essay clearly describing the muscles of mastication and movements in the TMJ. And this will include the lateral pterygoids, so you should focus on the lateral pterygoids when you're discussing the TMJ. For muscles, so lateral pterygoid muscles and the TMJ. That's where you'll want to focus when you get to that point, which we will discuss in this lecture. So let me bring up again the objective sheets quickly. So this is from your objective sheet that's printed or available on Canvas. There are the objectives. I want you to read the chapter on TMJ and pay attention to the section in particular on jaw movements with muscle relationships. That will help you organize your essay, give you an idea of detail. The description that the authors have written is good, it's technical, and it's appropriate for your area of study. It's written at your level for the dental hygienist. So read it and pay attention to it and follow along, spend the time. It's a description that you can't read just once and have it down. You've got to read it, look at the illustrations, and think about it. And then it should start to make sense. So you're going to be identifying the structures of the TMJ as we go along, discuss mandibular movements, elevation, deviation side to side, etc. And a slight amount of depression, as I alluded to earlier. Okay, so some suggestions to get started, some things to review perhaps that you'll need to be familiar with. Features of the temporal bone, which include the mandibular or articular fossa, the articular eminence, which is just anterior to the fossa, a little projection, and the styloid process, and then features of the mandible that you should be familiar with and be able to recognize quickly, the condyle of the mandible, the pterygoid fovea or fossa, the lingula, and the angle. Those will be discussed briefly, and then the spine of the sphenoid. Should be able to find that. Things to identify are the structures of the TMJ, which we're going to go through, the joint capsule, upper and lower cavities, the articular disc, etc., and then the ligaments of the TMJ. There are 3 of them that are listed, and then the actions of the TMJ. So the 2 main ones are gliding, forward and back, protrusion, retraction, and then rotation on a horizontal axis. So the axis of rotation you can think about as a hinge joint and which way the hinge is positioned. If the little pin that goes through the hinge is horizontal, the movement is going to be up and down. If the axis of rotation is changed, bones are going to move in a different direction. So we'll go through some of that. Okay, that may take a little bit of time to think about. That's terminology that's in that description of TMJ movements. So let's go to the slides. And this is the figure for structures of the temporomandibular joint. So you need to spend some time to get oriented. Here is the temporal bone. Put a little box on that to get you thinking about it. And here is that mandibular fossa. And then it goes out, and there is a articular eminence, which is this portion. So one is concave, the other is convex. Don't let that terminology sidetrack you. Here is the external auditory meatus, if that gets you located. And the mastoid process would be behind that. So anterior is to the right. And posterior is to the left. And we are, of course, looking at a lateral view. Okay? So here are the structures. There's the condyle of the mandible. And the articular surface. So that is lined with articular hyaline cartilage, like any other synovial joint, which this is. So there's the articular surface of the mandible. And there is a fibrous joint disc in the TMJ, which is shown in light blue. So this, of course, is the disc. There's some things to note about it. It divides this joint into two cavities. There is an upper joint cavity, an upper synovial cavity, and there's a lower joint or lower synovial cavity above and below the disc. And then you have a fibrous capsule that goes around it, like any other synovial joint. There's a capsule that goes around. And the anterior surface is a little bit flexible. Remember, this joint has to move. Remember that the mandible is going to move in this direction, forward and back, protrusion and retraction. And we've talked about the muscles that produce those two movements. So remember that. So that's pretty much the basic structure of the TMJ that you need to have in mind when you read that section in Chapter 5 and as we go through this section. Okay, so the next slide. Here are the ligaments of the TMJ. So I have a little box here that says, when you're done, you should know everything in this slide. So these structures are on that objective sheet. What you need to pay attention to, and where students kind of get wrapped around the axles if they're not paying attention, is in the view. So here's a medial view and a lateral view. And if you're not paying attention, you get these two confused. One's looking from the outside, if you will, laterally, and the other is from sort of a medial view. So let's do the lateral view first. You recognize, yes, there's the ramus, of course, and the angle, and the mandibular notch. Maybe you remember the coronoid notch. We're not talking about those anymore at the moment, but I mentioned them just for review. So here's the styloid process. You should recognize that on the temporal bone. And there is a ligament that runs from the styloid process down to the angle of the mandible, and that's the stylomandibular ligament. That's one of those that you need to identify and remember. It assists and helps prevent excessive protrusion. It sort of goes taut when the mandible is depressed. And then there is the temporomandibular ligament, the ligament of the TMJ, and it helps to form sort of this lateral portion of the capsule. It reinforces, it strengthens the joint. Okay. And then on a medial view on the right, here again is the stylomandibular ligament that we just looked at. Same ligament. Now we're on the medial surface. Again, you can see the styloid process. And then we have the spine of the sphenoid in red. And hopefully you can find that on an inferior view of the skull. And it attaches to the lingula, and that's the sphenomandibular ligament from the sphenoid bone to the mandible. More specifically, from the spine of the sphenoid to the lingula of the mandible. And deep to that is the opening is the foramen into the mandibular canal, the mandibular foramen. So that is kind of hidden by the sphenomandibular ligament. And you know what nerve passes through the mandibular foramen? The IA nerve. The inferior alveolar, which is innervating all of the teeth. And the sphenomandibular ligament, as you'll read about, is sometimes a barrier to anesthetic agents. If you inject in this area, you are hoping that that anesthetic agent will contact the nerve that's entering that foramen. Sometimes the sphenomandibular ligament can be a barrier. You just work around that. You'll figure that out, I suppose, as you do a number of those injections and realize there's a fair amount of individual variability between patients. Some are more effective than others. At any rate, that's for another one of your classes. So I think we've gone over everything in this figure. Again, pay attention to the lateral and the medial view. And then the next couple of slides are looking at the action of the TMJ. So here, of course, is the TMJ, anterior, of course, to the left, to the right. You should and posteriors to the right. You should recognize these structures that we just talked about. So there's the articular disc, the mandibular fossa, the articular tubercle or eminence. So it's that part of the bone. There's the fossa. And there's this articular tubercle, which is what the TMJ is going to pass through. And there are the two joint cavities, not shown in detail in this figure, but you know that they're there above and below the articular disc. So you just need to refer back 2 slides. Let me do that quickly. And there is your upper cavity and your lower cavity above and below the disc. Back to the slide that we were at. So you know there's one below and one above. Now, read the text that I copied with these figures. It's important. So, I'll just try to summarize it as we go through. It's obviously a picture of the TMJ, and it's showing the lateral pterygoid muscles relevant to this description. And then there's a note the gap between the heads. They're talking about this gap, which is exaggerated for the sake of illustration and explanation. And then it says each schematic drawing on the right, which is over here, shows a corresponding axis of joint movement. So the axis is the dot. So, and then you have these two lines. This is like a door hinge. Here's one plate of the hinge, and here's another plate of the hinge. And the pin that goes through the joint is right there. And this can move. It's on a pivot. So this is the axis of rotation. And it's pretty much running from ear to ear, going transversely, imagining it going transversely through the head. Okay? And the mandible is on this hinge, and it's going to go up and down, and it's going to pivot along that axis of rotation. So that's the language that the descriptions use. Okay. And then A box at the bottom. What they're showing over here is that the mouth is closed. The jaw is elevated, teeth are together. In this position, the head of the mandible rests against the glenoid fossa of the TMJ. Okay, so we're back into this position at rest, if you will. And what we're going to do is see how this picture changes. How the condyle on the left, if you will, is either going to stay in the mandibular fossa or if it's going to move anteriorly onto the tubercle. Okay? So before I go, well, let's keep going. I'll try to remember to come back and show you the book that these illustrations came out of. Next slide. Okay, so nothing has changed in this picture. So no change. As the mandible opens, so here's our axis of rotation again. And the mandible has depressed small amount to less than or equal to 15 degrees. It's not a, I don't care that you necessarily remember 15 degrees, but it's a slight amount of opening. So as the mouth opens slightly, the head of the mandible remains in the fossa. So there's no change. It's pivoted, which it had to do, of course, as the mandible was depressed, slightly. So the mandible goes up and down a little bit, and the condyle of the mandible stays in the TMJ. Okay, now we're going to open it further. So now we have opened it greater than 15 degrees. So there's our axis, or our planes of movement. And the TMJ has moved, the condyle of the mandible has moved forward. So looking at the figure on the left, the condyle has slid out of the fossa, the mandibular fossa, and now it's up on this articular tubercle, or this articular eminence. This is on the zygomatic arch. Notice that the articular disc moved with the mandible. It didn't just sort of stay flopping around loose in the synovial cavity. It stays tightly associated with the condyle. So the disc moves with the condyle. And then let's read the description at the bottom. So mouth open past 15 degrees, greater than 15 degrees. At this point, the head of the mandible glides forward onto the tubercle, onto that eminence. The joint axis that runs transversely through the mandible is also shifted forward. So all they're talking about is that we have moved this axis of rotation. I'm on the left, drawing a green dot in the condyle of the mandible. Remember that when the mandible was in the capsule, the axis of rotation was in here. All we've done is just move everything anteriorly. That's all they're saying. It is shifted forward. The articular disc is pulled forward by the superior head of the lateral pterygoid. So here is the lateral head. And let me clean up the picture a little bit. And the superior head of the lateral pterygoid is attaching more or less to the capsule and pulling that anteriorly, while the inferior head is attaching to the pterygoid fovea and pulling the mandible. So we're moving both the disc and the mandible together. Okay? And that's the last slide for the TMJ, and that's the last slide for this lecture. And what you need to do is to practice this. I will be asking you to describe this movement. So there's lots of time to practice it. Before I sign off, let me just take a moment to show you the textbook that this figure, this series of figures, these 3 slides came from. If you like anatomy, this is a great book. They come in a number of different versions, but the publisher is TMJ. So you can just Google that if you like. And they are, this book shows a lot of good dental anatomy. And it's written at a level that's appropriate for your class, as you can, I hope, see by what's written on these slides that I showed. Here's the ISBN number for this book. The ISBN numbers are constantly changing, so I don't know if that is helpful or not. If you just Google TMJ, and this one's Anatomy for Dental Medicine, you'll find something. It's a good reference. I think it's maybe $50-ish, maybe less. And it's a great reference if you want to keep one. Not necessary for this class. Okay, that's it for the muscle and the TMJ unit. And I'll see you during Zoom time. Bye.